Hi, Corey here from Align Therapy. A few thoughts on thoracic outlet syndrome. If you have been diagnosed with thoracic outlet syndrome or you're wondering if you might have this video might be for you. With thoracic outlet syndrome, it's a compression of neurovascular tissues that exit the neck as they travel to innervate to provide blood supply to our upper extremities. And so there are three common types of thoracic outlet syndrome. One is involving the nervous tissue being compressed, which creates numbness and tingling pain in the arm. The other is arterial or venous. So compression of the artery leading to the arm, or the return of that blood through the vein back to the heart. If either of these blood vessels are compressed, you might have different symptoms. If it's in the artery, you might have cold, paleness in the arm, accompanied with pain, numbness and tingling. If it's in the vein, it could be swelling, it could be discolored, along with pain symptoms. If you suspect that you might have one of the either the artery or the vein compressed, definitely see your doctor to have that looked at. That can lead to a serious condition. If you think you might be more of the neurogenic type, where the nerves are compressed, then there are a few things that we can do to help relieve compression on the nerves. There are a couple places where the nerves can be compressed primarily. The first one is what we call the scalene triangle, and that's in this area here, in between the upper trap, the sternocleidomastoid here, and there's this triangle here that's formed by the scalenes. They're these small muscles that connect from the neck to the first rib. And the nerves pass in between your anterior and middle scalenes. So a quick stretch that you can do is to tilt the head to the side away from the affected arm. Tilt the head, you're going to look slightly up, you'll feel a stretch along the side of the neck here. If you don't, or you feel like you need more of a stretch, you can also compress the rib cage and you'll feel more of a stretch through the scalenes. Holding for 30 seconds. You may feel increased numbness and tingling by doing this. What you'll want to watch for is if that goes away after you release the stretch. If it does, then that's okay. The other place where you can get compression in the nerve is underneath the pectoralis minor, and that's underneath pec major right here. It's a small muscle that connects from the first few ribs to an attachment point at the scapula here. To stretch this, there are a couple ways. One is a doorway stretch, which looks like this. You want to elevate the arms and keeping good posture, not slouching forward. You're going to bend at the knees and move forward till you feel a stretch in the chest. If you feel like this really aggravates your symptoms or is painful, you can also do this laying down with a foam roll or a towel. I'll show you with the foam roll. So this is a half foam roll. You lay this lengthwise. The other one will go here to support your head. You'll lie down with your entire body on the foam roll. Situate the one for your head. And if you're very tight right here, just being in this position, allowing your shoulders to fall back towards the ground with hands open, you may already feel a stretch. If you don't, to be very specific for this muscle here, let's say I have the tightness here, I'm going to raise my hands up, allowing my hands to be levitated off the ground and feeling that stretch right here, right in the chest, not in my shoulder, but here. making sure to keep my back flat against the foam roll. I'm just relaxing my arm down, feeling the stretch. So those are 2 easy stretches you can do at home. Again, you can substitute that for a towel roll if you don't have a half foam roll. Talking about posture, positioning of the shoulder blade can affect the compression that can happen on the neurovascular tissue. So we live in a world where we're at the computer, we're kind of hunched over, or we may not be aware that we are hunched over. So a couple exercises that I really like for reversing that posture and really opening up the chest is cervical retractions and prone scap retractions. So follow me over here. So first is prone scap retractions. Not everyone has a hole in their mattress, but what you can do instead is make a little donut with a towel to place your face in so that you're not smothering yourself. But I'm going to hold myself up so you can hear me here. You would be relaxed completely, but you want to relax the shoulders down. Don't push them down, but definitely make sure you're not starting with them shrugged. Then you're going to squeeze back the shoulder blades and then slightly raise the hands up off of the surface. Hold for 10 seconds and then you'll relax. Okay. A common mistake I see with this exercise is just lifting the hands up without any scapular involvement of the shoulders. So really make sure that you squeeze those shoulder blades back and then you raise and hold like that. Okay? So 10 times for 10 seconds. Doing that every day or every other day, depending on how hard that is for you. The next exercise, cervical retractions, is about reversing forward head. So the way this works is you want to stand with good posture as best you can. If you start this way, that's all right. Try and get a little taller. You're going to squeeze the front of the neck, bring that back as far as is comfortable. Hold for about 5 seconds and then relax to start. And similar idea, we're going to do this 10 times. 5 seconds. If you can hold it longer, hold it longer. But you can see how that's really going in reverse of the posture that I might find myself in if I'm sitting at a computer. Back and tall. Okay? So, those are a few key exercises you can do if you have neurogenic thoracic outlet syndrome. Be patient with this. Nerves do take a while to heal from any type of compression injury. Again, if you feel like you might have thoracic outlet syndrome caused by either the nerves being compressed or by blood vessels, make sure to get that checked out by your healthcare provider. We assess that here with physical therapy. You're welcome to go to any place that you have direct access to. It's worth getting checked out for your own health and safety. But thanks for watching.